My name is Emily Rupp, and I chose to do my topic on fertility treatment. I think this relates to healthcare management due to the many ethical issues, high cost, and lack of access to treatment. Infertility treatment is an issue that healthcare managers face in their hospitals and clinics every single day, and I want to bring awareness to the difficult decisions that go along with it. I first want to start off stating a quote I found to be interesting in regards to the topic of fertility. According to Johnston, 50% of women and 15% of men rated infertility as the most upsetting experience of their life. Clearly, this is not an issue to be taken lightly, and as a healthcare manager, we need to take this into consideration. Infertility is a problem that affects about 9% of all couples. Many people seek treatment because of various reasons, including ovulatory dysfunction, the male might have a low sperm count, or the female might lack viable eggs. In some cases, both the male and female are affected by infertility. Because women are now hoping to produce children later in life, they choose to obtain treatment as it's harder to conceive naturally. They also don't produce as many eggs the older they get. The most common reason women gave for procreating later in life was due to the lack of a partner. Then was followed by a lack of finances and a lack of access to treatment. Fertility treatment is very costly and is more common in larger cities where there is a greater amount of specialty areas and hospitals. This makes it more difficult for the people who live in rural areas. Healthcare managers need to work on making treatment more affordable and accessible to everyone. There are several different options when it comes to choosing a fertility treatment. ART, or assisted reproductive technology, outcomes have declined with age in every country. Although the United States has the highest implantation, pregnancy, and live birth rate, infertility is still an issue. Other countries have to deal with infertility more frequently, but the U.S. has more options. One option is fertility drugs. This is when a woman takes oral or injectable medication to produce eggs, and then she has intercourse during the span of time she is most fertile, or receives the sperm through intrauterine insemination, which I will talk about in the next slide. So, intrauterine insemination is also a possibility. This is when the doctor increases the density of the healthy sperm at the site of fertilization. Many doctors and researchers recommend trying intrauterine insemination first, as it's less intrusive, easier to execute for the examiner, and has fewer health risks for the patient. It's also one of the less expensive treatments offered. It is still pretty pricey, as it can cost around $850 excluding medication. Another popular option when treating infertility is in vitro fertilization, also known as IVF. The sperm and egg are created in a lab to form the embryo, which is then transferred to the woman's uterus. Many choose this option as they feel it's more of a guarantee that the egg and sperm have already formed together. However, this process is more intrusive and complex. This is also one of the more expensive treatments. A full IVF cycle in which the embryos are created in the lab and then transferred costs around $8,000. On top of that, the medication necessary to take after the procedure costs an additional $3,000 to $5,000. As you can see, the cost can quickly rise. However, most researchers recommend if the male has a sperm count of less than 1 million feasible sperm, IVF should be the treatment of choice. Donor eggs and embryos are offered when a male or female or both are infertile. This is where a third party donates their eggs, which is then inseminated with your partner's sperm. This is also an expensive process, as a fresh egg can cost up to $30,000. Many ethical issues precede this option of treatment, as you can choose the egg or sperm needed. The patient is essentially choosing the genetics of their child. Gestational surrogacy is the most expensive treatment. This is when there is a legally binding contract involving a surrogate carrier who carries the embryo until birth, then waives all parental rights to the child. This can cost around $150,000. The embryo is produced through the IVF process and is then transferred to the host. Some drawbacks of this option are the expensive cost, as well as the surrogate mother might decide to keep the baby after all is said and done. There is a high psychological risk for both the surrogate mother and the person paying the surrogate. For the surrogate mother, it involves going through 9 months with the child, all to give it away. And for the parent receiving the child, they did not receive the same attachment the surrogate mother might have had. It can also involve more medical treatment for the surrogate mother, which costs the hospital. There are several other ways to treat infertility, but I just listed some of the popular choices. With treatment comes many decisions for the patient and the provider. Some of these decisions are considered unethical. Something else that is discussed heavily in the topic of fertility is the ethical concept of the subject. The reading showed 3 main ethical concerns. For one, it belittles the enormous importance of childbearing for most people. Since the procedure is not considered medically necessary, there is a lack of resources. This can send signals to the patient that their medical need is not as important as someone else's. For the second ethical concern, it ignores serious health and social consequences of infertility. This is a major issue because the idea of being infertile is not a social norm. This can lead to further health risks for these patients, such as depression. These other health issues could lead to more medical costs in the future. And as healthcare managers, we are trying to prevent further medical expense. Lastly, not being able to seek treatment undermines the patient's autonomy. Since autonomy allows an individual to choose what they want to do with their body, healthcare personnel should always be informative and exhaust all options if the patient so wishes. According to Sperling, those given a questionnaire regarding IVF all agreed that every person has a right to procreate. 15.25% of those questioned believed that it is important to screen candidates who are thinking about fertility options. The screening process involves general questionnaire asking about the patient's medical history, such as age, health, HIV status, and other significant illness. Over 65% inquire further into marital status and addictions, but only 44% inquire about the physical and mental condition of other children in the family in regards to suicidal background. 32.6% ask about the spouse's tendency for violence, and 21.7% ask about the stability of the relationship. By looking further into their personal life, one would be able to see if the patient is ready and willing to care for a child. This, however, becomes an ethical concern when you look at it from a different point of view. Would this be necessary for someone that was fertile? This topic also sparks the discussion of having to use donor eggs. Since it is not the patient's direct line of descent, it is similar to the adoption process. This process also includes a screening of the potential adoptive parents. As a healthcare manager, it is important that we meet the needs of our patients. One way we could do this is by lowering the cost of the treatment. For ART, or assisted reproductive technology, the length, price, and outcome are all uncertainties. When going through the fertility treatment process, there is always a slight risk that the first embryo might not take. This is a risk that is taken every time the process is implemented. Since there is no guarantee of the desired outcome, the patient must account for the price of the treatment each time. Prices can vary from doctor to doctor, and hidden fees are usually involved. While most insurance companies do not consider fertility treatment necessary, some will pay for the procedure and not the medication, or vice versa. Oftentimes, this can still add up to be financially detrimental. Some of the most frequently reported unmet needs are financial coverage, improved implantation rate, and egg donation. A way to combat the rising prices is by conducting research regarding which is the most effective fertility treatment. Initially, research will be costly, but once the treatment with the best outcome is discovered, we can lower the cost by reducing the number of times the patient has to undergo treatment. We can also go automatically to that form of treatment so the patients do not have to waste their time. To improve the chances of conception, the infertile couple must be aware of the fertile window of the woman's menstruation. Typically, couples will plan their fertility conception around this time span. According to Hampton, only 12.7% of those trying to conceive could accurately identify the fertile window. This is why it is so important to educate our healthcare team, because they can relay this information about the fertile window to their patients. A way we can do this is at our conferences by introducing a fertility specialist to come and speak on the behalf of their patient and their concerns. People who are concerned about their fertility should be informed that sexual intercourse every 2 to 3 days optimizes the chance of pregnancy. Through enhanced education, the patient is more aware of their fertility options and can utilize this by making their treatment as effective as possible. In conclusion, the education of fertility treatment and which treatment is right for the patient lies in the hands of the healthcare team. While infertility can be devastating, the United States has many ways of treating the issue. Fertility drugs, intrauterine insemination, in vitro fertilization, donor eggs and embryos, and gestational surrogacy are some of the many options in hopes of producing a child. A patient must consider the monetary and ethical demands of these procedures, as well as the healthcare manager, before going through with any of them. It is the healthcare team's job to assist their patients in choosing a procedure, if any, and educating them on the window of opportunity for conception. This is my bibliography for where I got my information. And that is it. Thanks for listening.